Tonight's Real ER, paramedics ride to the rescue after a horse kicks up a fuss.
Keep your head still for me, sweetheart.
And demolition man David Porter puts on a brave face as doctors treat his bizarre injury. All this and more tonight on The Real ER. It's a hot Friday and paramedics Steve Moore, Ray Earl and Andy Jeans are working the twilight shift from 4 until midnight. They've been called out to a woman who's been thrown by her horse and knocked unconscious.
Yep. How do we get in?
This gate here. Will you get past these cars, yeah?
I'll take a wander down.
Tell me.
It's electrified.
Are you joking? Yeah, she said.
The horse which threw rider Lisa Rigby is over 15 hands high, and due to the dry summer, the ground where she fell is rock hard.
I can't remember. Where do you live?
Yeah. Can we take the head round?
Yeah, if you want to take the head, mate, and I'll start the interview. So you don't know how old you are? That's a good thing, though, isn't it, sometimes? You got any pain anywhere?
My back.
Your back? Where in your back?
Top of my back.
The top?
Yeah.
Right, by your shoulders or lower down?
Between my shoulder blades.
Between your shoulder blades. Can you move your feet for me?
Because of the neck and back injuries, Ray calls for a spinal board to immobilise Lisa, ensuring she's kept flat for the drive to hospital.
Okay, I'm just going to pop a little collar on your neck, my love, all right?
Okay. Okay. Now, if we talk to you, you say yes or no. You don't shake your head. That's good. You're doing marvellous.
And as she's complained of nausea, dizziness and pain in her upper back, all signs of spinal injury, it's important to get her back to Selly Oak
Are
quickly.
you ready? 1, 2, 3.
You all right there, Lisa? Slow ride, yeah.
Because of the possible crippling nature of her injuries, she'll benefit more from a smooth passage.
Do you remember how old you are yet, Lisa?
No.
No.
Now that Lisa is stabilised, Ray can monitor her progress. The more detailed information he gives the doctors, the more they'll be able to do for her. It's been the hottest summer since records began, but staff at Selly Oak battle on. High temperatures have led to an influx of insect bites. Christine Humphrey's skin has proved to be particularly tasty.
I was hanging my washing out and I felt as if something just went on my arm, and when I went inside it had come up like a blister. I put some cream on it and I took an antibiotic that I'd been taking for some other bites I'd had, and it just won't go down and it's very itchy.
While Christine waits to be seen in See and Treat, Ray continues to question Lisa.
So what's the name of your horse? You don't know. How often do you ride, Lisa? Most days.
By asking questions he knows the answer to, Ray can gauge whether Lisa is making sense or if she's still confused after her fall. Lisa's partner, Matthew, has followed in his own car and is quickly reunited with her.
Okay, let's have cubicle 2. Yes, cubicle 2's empty, should be. If it's not ready, I'll come and make it up.
Once checked in by staff nurse Sandra Taylor, Lisa is put in the hands of the trauma team. As her fall took place in the open countryside, Ray was grateful for Andy's help.
Well, I've worked with Andy in the past, so it's not too much of a problem. And once Andy got control of the head, basically, whoever's got the head is in charge of the whole job. So thank you for volunteering.
Thank you very much for asking. 1, 2, 3. There's nothing about the clinical qualification as to why I got the head. It's just I was in the right place at the right time. Ready?
Because of her concussion, Lisa was kept in for observation overnight, but went home fit and well the following day. In See and Treat, Dr. Sam Williams is mapping out the boundary of Christine Humphrey's infection from her insect bite.
I didn't want to brand you, but it is simply because I've marked it as a line of demarcation to know now what's happening, so that by the time we see you again, when you review in the clinic, we'll be able to assess whether the redness is getting smaller or spreading.
Christine will be given steroids and antihistamines to neutralise the infection.
It could have been from a bee, and usually what happens, the sting tends to give a localized reaction, and instead of reducing in size, it tends to spread. We'll try and see if we can remove the sting, and that will make life more comfortable.
The number of insect bites and stings treated this summer is 5 times more than last year, so staff have been particularly busy.
If you've actually been bitten or stung, the obvious thing is, well, let's squeeze it a little bit, see if we can get the sting out and see what happens. And that unfortunately introduces infection into the wound, so then people turn up in A&E with swollen fingers, legs, wherever they happen to have been bitten. And obviously canned drinks, people, that's quite dangerous if they're stung in the mouth.
It's just like a plant having a root. If you don't remove the root, what happens? It grows. So that sting, which is the primary factor of all what's happening there now, has been removed.
Is it for yourself, sir?
No. Oh, it's a guest we have with us.
Oh,
Ray and Steve's next call is to a 75-year-old lady with a history of angina, heart attacks and chest pains.
Terrific pains around me.
Are they below? So is that below your rib cage? More in your abdominal area?
Just above it, just round there.
Okay. What's concerned you now to call for an ambulance now at this point?
Because it's all in my back, all at the back.
Okay.
And it hurts to breathe.
And it hurts to breathe?
Yeah, I can't get my breath much.
Okay. What do I do? My mate's going to give you an aspirin. Get it to chew it. Are you all right with that?
Yeah.
I'm going to pop this into your hand, OK?
Right.
There you go, my love.
Which is a big one, isn't it?
Yeah, horse tablet, that one.
I'll tell you what, it's warm.
To help Iris breathe more easily in the hot weather, she's given oxygen for the journey to hospital.
Watch your back, Steve. Sit down.
At Selly Oak, demolition man David Porter has checked in with a bizarre injury which has taken even him by surprise.
I've had a few, but this is it's a bit different, this one. I was cleaning up some debris and loading some stuff into a barrow, and I sort of threw a heavy piece into the oil barrow. It's catapulted that piece of timber up and stuck into my wrist. It is hazards of the job. You think you're fine, you think you're just going to go through the day and nothing like this will happen to you, and every so often something does.
If David's done any internal damage to his wrist, it should show up on the X-ray.
Is it painful at the moment?
It's just a bit numb, to be honest.
This is the piece of wood, it's coming just here. You can actually see there's some soft tissue swelling around here and some changes in the soft tissue. It's cast a shadow over the top. Wood doesn't really show up on X-rays, but we wanted to see really whether there'd been any bony involvement. Really, the only way you can tell is actually on examination, where it felt like it had gone in just a little bit. It actually gone in further than we expected, gone in about 3 to 4 centimetres.
Before setting off, Ray and Steve make sure Iris is comfortable.
Oh, I'm thirsty. Any tea for a drink or not?
Well, I'm afraid the buffet car is out of service today.
Husband Reg is on hand to help with any awkward questions.
Get some blowers going.
They're back at Selly Oak within 8 minutes.
No, therefore we realised they were there. They said they was coming in, and all of a sudden they was there, very quick. They've done their job quite well, and excellent, I thought. Yeah, very good.
Well done, Iris.
Iris left Selly Oak the next day and is recovering at home, but undergoing further tests for heart problems.
Excellent.
Demolition man David Porter is bracing himself before becoming unstuck.
You happy? Okay. You ready? Okay. 1, 2, 3.
That's it. Well done, well done, well done. Ooh, there's quite a good bit of it in there, isn't there? Yeah. Okay, I think now that it's out, we'll lie you down.
Okay.
All right, because you look a bit pale to me and it's hot. Right, we should get the blood back to your head.
The removal of the stick wasn't as pain-free as David led us to believe.
Fairly painful coming out, but relieved to get it out now, so that's better. They seem to think there's no nerve damage or ligament damage or whatever, so I'm fairly hopeful. They want to clean it up and have a proper exploration of it, but fairly confident it'll be okay.
An investigation in theatre found a splinter, and after the wound was thoroughly cleaned, David was given the all clear.
I got up here late last night, pretty much out of it. And this morning, a little bit of numbness, but everything seems to be fine now. Movement's back and everything, so hopefully I've been told I can go home later today. So everything's good. I'm not quite sure when I'm going to be back at work. Quite happy to sit here watching the TV and drinking coffee and eating biscuits. Nice change.
It's now Friday evening and the number of calls is rising steadily. Paramedics Steve Moore, Ray Earl and Andy Jeans are on their way to help a 10-year-old boy who's been injured play fighting with his brother.
We've just been assigned a case now to the southern side of Birmingham to a 10-year-old child with a query fractured arm. It's now approximately 8:45 on a Friday night, and we've just gone over the 1,000 case number. So that's 1,000 cases that Westminster Ambulance Service have done so far today, and it's on the increase.
Steve's gone on ahead to look at the injury. He decides to splint the arm straight away to prevent any further damage occurring.
Okay, Elijah, what we'll do is get you to stand up. This arm won't move now, okay? It's nice and straight. All right, as straight as we can get it. All right, son. You're a brave lad, ain't you, walking out? We'll let you have a lie down on the ambulance, all right? Go that way. Okay, swing your legs up.
Once Elijah is settled down, the next port of call is hospital.
We'll put something under that arm, yeah?
Mm-hmm.
You know, if we was going to score your pain, 10 being the worst pain you'd ever had, and 1 is like pain you can deal with, what score would you give your arm? A 10? The worst pain you've ever had? How come you're not screaming and riding around in agony? Do you want some Calpol? That'll help take away the pain. Have some of this. Now put that into your mouth and then squeeze it out. Elijah? Elijah? Elijah, all right. You getting it? Suck that out. Yeah? Is that horrible? Do you want another one? You don't want another one?
The painkiller seems to do the trick.
There's the pain now, Elijah. A bit better. We've done some of the right.
In the emergency room, the Selly Oak team has been treating bricklayer Dave Varley.
I just slipped. Building site and my leg just gave way.
Dave is due to be an usher at his best friend's wedding on Saturday.
June's going to give you some pain relief in through there, and then we'll send you down and get you x-rayed then.
Yeah,
okay?
sound. Cheers, mate.
All right, good night.
I just dislocated that one.
It looks a bit of a funny shape, so I wouldn't be surprised if there's something broken there as well. We just have to wait in the x-rays and have a look.
An operation or?
Until you've had your x-rays, I really couldn't say.
If the x-rays reveal Dave's knee is broken, he won't be going anywhere this weekend. The ambulance crew suspect Elijah's arm is broken, so they take him to Birmingham's Children's Hospital for an x-ray.
Selly Oak don't actually deal with paediatrics as such. They'll see you if you take them in by your own car, but by ambulance-borne patients, we bring them into the children's. Elijah, good to do. Get the bed up to this height.
And then with our help, I'll support the arm, you can shuffle over, yeah?
And you mustn't fall down the hole in the middle. Okay.
That's it. All right, keep going.
Good boy. Well done. Okay. Should we sit you up a little bit more?
We do get more children during the summer holidays, but generally they come down with coughs and colds normally. So to have a child with a proper traumatic injury makes a change to our job, yeah.
Elijah was operated on the following morning to pin and stabilise the fracture. He's now gone home. While Steve and Ray continue on their rounds, Albert Bevan has been acting ambulance driver for his son Colin, injured in an accident at work.
I had a bang in the factory, and one of the lads came up and said Colin's had an accident. And just put him in the car.
Just bending a piece of steel at work, and the steel cracked, and 5mm steel, it shot up and it smashed me in the face.
Colin Bevan, please.
It was really painful after I'd done it. It was just a burning sensation.
Everything you're right.
A&E Registrar Dr. Jerry Amana is assessing the injury.
What's happened is that the corner of a steel plate has hit his face, and it's caused a laceration or a cut to above his upper lip, and it's gone through his lip as well. Now, I can stitch that, but for cosmetic reasons, we've got specialists in the face, and we like them to do this kind of injury.
The maxillofacial surgeon will work to limit the scarring on Colin's face, but as the cut is in an awkward position, it won't be easy. In Resus Bay 4, bricklayer Dave is waiting for his X-ray results. It's good news. They show his knee isn't broken.
He actually has what's called a patella alta, which means the patella bone itself sits too high in the joint, and as a result it's basically got too much freedom to move, and that moves out to the side, and that's what's happened in this case.
Now all Owen has to do is pop Dave's patella back in. It's his first time. Surgeon Commander Geraint Evans is standing by to give advice. Not that Owen needs it.
Going.
There we go.
All right, you mates.
Life.
You can swear if you like, but it's back, it's done.
Oh.
Have some more breaths of that.
Yep.
Have some more breaths of the gas, it'll help with the pain.
With little time to draw breath, the paramedics are called out to an assault in a busy Birmingham street.
It's 10:30 on a Friday night, and the case number is now 1,144. So there's still another hour and a half to go before midnight, and plenty of other cases to go to, because we're a midnight finish today.
A man has been in a brawl while break-dancing outside a bar. Bystanders are unwilling to give details to the police, so Ray and Steve don't know if any weapons have been used.
Crowd, big crowd.
Once they've stabilised the patient, he's treated for the worst and brought back to Selly Oak.
Right, how do we get out of here?
I was going to swing it round.
I'll follow you then.
He's been drinking and has a head injury. However, before doctors can find out exactly what's wrong, he discharges himself. So, do Ray and Steve ever fear for their own safety?
You've always got to be aware of what the situation's going on around you, but your primary role is there to treat the patient. Yeah, there is concerns. Normally, if it's a really violent situation, we normally have to rendezvous with the police at a certain point, and we don't go in until the police actually check that the scene is safe for us to attend.
But it's not something you have at the front of your mind. You do rapid risk assessments and make sure it's safe. If it's not safe, you don't get out of the vehicle. But I don't actually come to work fearing for my own life.
On this particular Friday, the West Midlands Ambulance Service answered 1,250 calls, nearly one a minute. And between 6 p.m. and midnight, a fleet of 115 vehicles manned by 196 staff operated on the road. In the A&E theatre, Dr. Usman Waheed is using his expertise to keep the scarring on Colin's lip to a minimum.
I'm just closing the inside of the mouth first. Then I'll be closing the muscle layers from the outside of the mouth. And then the skin layer on the top. The pink line of your lips needs to be closed so the line doesn't break. If the line isn't in the same place, then your eyes tend to pick it up, so it's a scar that everyone notices quite easily. There will be some scarring there, but eventually it should get back to kind of normal.
If Colin hadn't come to hospital, the wound would heal naturally, but the scarring would be much worse. Dr. Waheed is used to treating this type of injury.
Keep as still as you can. Industrial accidents are quite common. Usually not as lucky as this. This is quite lucky. I know you got a cut there, but they can be a lot worse.
Oh, it could have been a lot worse.
Could have been a lot worse.
Still really saw that inside the mouth. Inside the bottom of it,
There's a little cut there that doesn't need any stitches.
I know, that you just really, really sore.
I know, but that
that
doesn't need any. I'm just going to clean you up a little bit now.
Check.
The operation has taken just under an hour to perform. In all, Colin had 22 stitches, 8 on the inside of the lip and 7 on the outside. 2 guide stitches to get the line of the lip right, 3 to hold his lip muscle in place, and 2 on his chin. Not surprisingly, Colin was speechless at the end of the operation.
Are you okay?
In resus, bricklayer Dave is regaining his composure after his dislocated knee was put back in place.
Now before we...
swollen?
Yeah, it will be swollen. Like I said to you before, for the kneecap to come out, it has to tear a lot of the soft tissues around it, so they will have bled and caused the swelling.
It's quite a strange thing to do, to be honest, because you have your hands on one side of the kneecap itself, and you're trying to basically just push it back into its original position.
Oh, yeah!
It's not a trial and error thing, but you will just suddenly feel it go, and it's quite a rewarding thing for me to do it, and there'll be a bit of pain for the patient, but only very slightly in comparison to the pain he's been going through.
Just bend up again slightly, good. He does it. I've never yet had a leg come off in my hands.
You've done a good job. A lot happier, and knee feels a lot better. And hopefully everything goes all right now. It's my match wedding on Saturday, so hopefully I'll be there to wish him good luck.